Welcome to Talk to Me. I'm Loretta Phelps, and today's guests are Andrea Johnson, MSW, Melissa Ballman, LMFT. I want to welcome you ladies to Talk to Me, and thank you for coming to share your knowledge and service of being a mental health professional. Today's topic is mental health from a professional view. Once again, welcome and relax. It's going to be great, okay? All right, so the first question today, as a mental health professional, are all diagnoses accurate?
It's a great question, and I would say no. In terms of a diagnosis, what that is a cluster of symptoms or things that are happening right now that someone is experiencing that when you add them all together, give you a diagnosis. And so as a mental health professional, when you're working with a new client, you're assessing them based on what you're seeing right now. And that can change.
Exactly.
From day to day and over time.
Right, because I was thinking more or less if a person is psychotic or out of character coming in, then later on the dynamics of that person would change. What is your view, Drew?
I would say as a social worker, I do see a lot of misdiagnosis, and I think that when we come in to overview everything, we send clients like that to people like Melissa that are licensed so they can not deeper diagnose, but deeper overview what's really going on with the client at the time.
Very good. So we're saying after years of treatment, then that could change for a person. And then what does that look like after the fact? From the actual intake, what does it look like? Maybe 6 months? Does it change within that time frame?
I think that depends. It depends on the person. It depends on the diagnosis. Some of the diagnoses that we work with are more severe and persistent. So things like schizophrenia or long-term diagnoses, those may not change much over time. Maybe with medication or treatment, the symptoms may be less severe. So obviously the goal of any kind of treatment is for our clients over time to be able to manage their symptoms. Maybe they will actually reduce, but if not, give them ways to be able to live day to day with that diagnosis.
Thank you so much. With that, Andrea, with the population that you serve, could that be true with that population? And can you just give me a general picture of what population that would be?
Okay, well, since I work with the youth, youth and family, I see a lot of the children are in need of more individual therapy, like wraparound services, and a lot of them have not, like the first question, have not been diagnosed correctly. So it's very important to focus on that youth first, and then intake everything else as a family as a whole.
Okay, so pretty much thinking about treatment and those type of things, what tools do you use to properly treat the individual?
So I think it depends on your setting, the client, the kind of symptoms that are presenting when they first come into treatment. So I think first and foremost, taking the time to do a thorough assessment, get to know each client. Oftentimes, like Drea said, the families are really important, or the other prominent people in their life, to get a better understanding of what's going on. That can just be through talking. It can be through using specific assessments or questionnaires to kind of narrow down what's going on.
So what would be your favorite tool as far as assessment and tools? Can y'all identify for me, Drea, tool? What am I speaking of when I say tools?
Okay, so I would say a tool would be possibly for me with understanding triggers, like possibly like what is possibly triggering that particular person, and how can we enter in coping skills and see if that works, and then if that doesn't work, then try something totally different.
Okay, so it's like assessing the behavior, and then the tools that I would use would be more like your back. Those type of things are what we call tools. So can you distinguish an outburst from a psychotic break, or are they one and the same?
Sure.
Okay.
I think most of the time, yes. I think when we think of an outburst, we picture, or at least I picture, someone that's maybe, yelling or kind of having these like angry type symptoms. And they may be more temporary in nature. There's oftentimes an identified trigger situation, something that happens first that someone is kind of responding to. Versus when you think of a psychotic break, it's more permanent in nature. A lot of times that's what we think of like psychosis symptoms. Oftentimes people that are experiencing psychosis have kind of lost touch with reality. And so they may be having thoughts that don't make much sense or conversations that seem to be all over the place. They're more responding to things that are happening internally as opposed to a trigger.
So we talk about anger management classes and how a person acts out on their anger. And I think for me, just working with that environment, that population of people, it's more like what happens as a child that goes unaddressed, and then you grow into an adult. Could some of those triggers, those trauma situations, kind of like are instilled in that person as an adult to make them act out in an anger type behavior?
Yeah, I believe so. I believe that everything starts in the first stage, like an infant stage. If they're not getting that love, that support, that nurturing in the beginning stage, it's going to trickle over as they grow into a toddler, a teenager, a young adult, and an adult. And I feel as if parents or just people in general that are caregivers over those people, if they don't address it at that particular moment, then it's going to trickle over into like very like explosive situations.
And so that's basically where those misdiagnoses come into play, because when a child is bullied early on in life, it creates a lot of emotion. Fear would be one of those things. Safety. And we get into the hierarchy of Maslow of those things that we need. I forgot the hierarchy, but what you know what I'm saying? The safety, the love, the basic needs. You always meet the basic need, right? But then as you start to develop as an individual, you start to experience, am I safe? So in a person who's dealing with mental health issues or just in general, they have to find that familiar place of safety, wouldn't you say? So how would that look to a person when you're telling them about, when they're talking to you about not feeling safe, and then what kind of coping skills would you give that individual? Melissa, go ahead.
I think that's where really coming from a trauma-informed and person-centered approach is really helpful. So that's going to look different for everybody. I would say that developing that sense of safety really starts when someone first walks in your door. Making sure that the environment is welcoming, that we're mindful of things that may be trauma reminders. So that might be things like lighting, certain smells, how you greet someone, being mindful of, not walking up and hugging someone or forcing a handshake, or things that we don't know what someone has experienced or what might be triggering. So I think like any other good relationship, that takes time to develop, and oftentimes just asking permission first if something is okay.
Yes, that's great. That's great. What is your view? How do you make that happen for the youth? Because we know that the youth are very apprehensive. They kind of guarded. They don't open up right away. So if you're treating the youth, 14 to 18, that would be the youth. So how would you address that with them?
Well, I would say, since we are still doing Zoom, I read body language first, and to see if they feel uncomfortable, because the children, they are the adolescents, they are basically constantly looking at a screen all day anyway, because they're in school on Zoom or in class or whatever the case may be. So I'll ask them what makes them feel safe, whether it's being in nature or just going to the park, or whatever it could be. I try to meet them where they are.
Okay.
So I'll try to meet them out in the community to make them feel more comfortable to express whatever it is that they're feeling at that moment.
Yes, and also my experience has been with youth and adults. Even though we're meeting them where they are, we still have to be able to identify with the culture. Because of the diversity of the city that we live in, we have so many cultures here. And how do you all cope with your own mental health? And you have a person who has been traumatized. How do you separate as a professional and then as an individual person who has humane concern? How would you identify that, Melissa?
Well, I think first we've shifted from terminology of cultural competence to cultural humility.
Okay.
And I think that's an important shift, because no matter how much research or education we obtain or how many people we talk to about their experience, we can never truly understand what it's like to have those particular set of circumstances that make us who we are.
Okay.
And so I think as part of that, it's really, again, just getting to know each person that you're working with.
Right.
As part of going into the mental health field, we're here because we want to help. And so part of that is learning how to, help yourself before you can help others. And so things like making sure that you have really good self-care. You have ways that you can relax, take care of yourself, recharge.
Right.
And then helping our clients be able to do the same.
Right. And so we say rapport.
Mm-hmm.
Rapport is building that relationship where you start to initiate that trust, providing that as women, you all are very nurturing individuals, okay? So who determines the level of treatment for each client that comes in? Where does that go as far as...
So are you asking like if they need to go to a psychiatrist?
Yeah.
Okay.
The levels. Okay, you come in from the intake, right, and then you, as the therapist, identify, right, and then you make that referral, that what we call higher level of care within your agency or your organization. So who really determines that? Is it the treatment team? Is it the doctor? Is it the therapist? How would that be? What happened for an individual?
I think in terms of determining what type of treatment we're looking at, level of care, it really should be a collaborative process. People come to treatment for a variety of different reasons.
Okay.
Some of them come for their own on their own will, or because they're looking for help and support. Other people might be mandated to treatment by sometimes a loved one that's kind of demanding it, but sometimes the court, sometimes it really depends. And so I think it's based on the information that you gather in the assessment, kind of the acuity of the needs, what you're seeing, and then also what really works for that individual. So that might be outpatient care, that might be an inpatient hospitalization, it might be medication management. It just really depends on kind of what's going on.
Is that part that we talk about, the ASAM levels of care,
or wraparound services as well? That can be a big help for youth, and sometimes for adults as well. I don't know if they call it wraparound services.
It's wraparound when you have a team of people identifying the need of that person, and what happens is that the team gets together and determine what is necessary for the youth. So Melissa might say, well, I think John needs not only therapeutic services, but he may need more psychiatric interventions, right? And so I think that's how it would go in your world, right? Okay. So in that, and thinking of that term, is mental health defined by social economic status? you know, my take is that if you are poor, you're in one system. If you have cash, a good cash flow, you're in another system, which is private, right? And do you think it's fair that an individual who gets caught in the community clinic has a different situation than a private therapist? Because what I'm saying, and y'all, we can talk about it, okay? But what I'm saying is that in the clinic, you have to have a diagnosis and you have to have some medication in order for the insurance to pay, right? In the private sector, you just have a therapist who will work more with you rather than a community clinic who's building on numbers, right? So wouldn't that make us slight different? What's y'all take on that? How would you view that? Because I see Melissa eyes just, the little thoughts just rolling like so Drea, give me your take on it.
I definitely agree with you. I think that the poor community definitely gets the lack of services the most because it is more about numbers. I mean, we all can see from working for community, some community companies, all of them that we worked for wasn't the best. And they did not provide the best services because it was either lack of resources, or they just had workers that was there just to get a paycheck, or they just didn't care. Right. But working with private companies, they have more time. They can move things around the way that they would like to, and they can use their educated resources or people that they've partnered with to help whomever is on their clientele list. Right. So that's my take on poor. Well, what did you say? Poor.
Poor versus comfortable finances. Yeah. What's your take, Melissa?
Yeah, I think it's one, it's not fair, but also I think it's a really good argument for the need for more change and legislative change on a higher level to reduce barriers to quality care for everyone. I think a lot of times the system is overtaxed, right? Especially right now with the pandemic, there's not enough mental health resources for everyone who needs it. And so ultimately, yes, if you are lower in socioeconomic status, you may have a harder time finding care and finding good care.
Exactly.
And then also we think about like you said, like the legislative or whatever, like they feel as if that mental health is not important. Like people should just get over it. It's not that deep. You're depressed, get out of the mood, but it's not that easy to snap out for a lot of people. Right. So I think that the money that goes into the poor communities is not for that. Yeah, it's for them to stay on food stamps. Yeah, it's for them to, stay on government assistance in general. But however, when it comes to taking care of the mental, so that they can be able to, like you said, the Maslow's hierarchy, so they can be able to build up their esteem or their safety needs, or whatever the case may be, they're not able to do that because it's not being taken care of in the poor community.
Or it could be defined that the lack of an emotion that everybody wants. That we come here thriving on that once we begin to identify with it. And love is the breakdown. I would think that's the breakdown in anyone's life, who, especially those who what they call needy. But how can you be needy when you have a desire to be loved by the parent, by the sibling, by the friend, by the spouse? It goes in that order, does it not, Melissa?
Yeah, I think everyone has. If we go back to the hierarchy of needs, everyone, of course, needs basic needs met first. So food, shelter, housing, water, safety, and then working our way up. Before we can get to self-actualization, there is a level that does require intimate relationships and the development of empathy and love.
Yes, okay. I am so proud of you. So I just want to let everybody know that we all have worked together, and I am just really amazed at the professionalism that you all are really presenting. That lets me know that you truly care about your clients. I think you can, and you can tell me if I'm wrong, but I know you can separate the relationship and still provide some of those basic needs. Is that true?
For the clients that we're working with?
Yes, and how do you do it? How does that, what does that look like in your profession?
In terms of being able to provide basic needs, I think if we're looking at treatment from a holistic approach, and we understand that oftentimes our clients can't work on processing past trauma, and they can't work on processing some of those deeper needs when those basic needs aren't met. And so that's where a lot of knowing your community that you're practicing within is very helpful, because a lot of times we do provide resources and referrals for our clients to make sure that they have stable housing, that they have access to food resources, childcare, employment opportunities. All of those different aspects are part of mental health treatment, because they all go into supporting an individual as a whole.
Keeping that balance. Sure. Okay, so is it possible for the community to assist neighbors, to assist a neighbor with mental health challenges without presenting harm? Say for instance, somebody out in the yard acting out, do you just instantly dial 911, or would it be safe to not be a professional and still try to assist that person?
I think it just depends on, well, my opinion, it depends on if people are educated on mental health or not, because I think most people do call 911 when someone is acting out of character or something is not normal to them, because they're scared themselves. But however, I do feel as if that if someone is educated on mental health or has experienced mental health themselves, I think that they may know what to do to help that individual to either calm down, maybe not calm them all the way down, but get them to maybe a 6 or 7.
Okay, your take.
Yeah, I think it really depends. I think first things first, just assessing the situation and seeing, is that person safe? Are you safe? Would you be safe to intervene? But then back to your original question, I also think there's a lot of ways that we can, as neighbors and friends and community members, support those around us who may be, struggling with mental health. That might be just checking in on them and making sure they're okay. If you know that your neighbors may be struggling to do everyday tasks, walk their dog for them, or bring them dinner, or things just to kind of help them cope, get through their day, let them know that you're there to support. I think that can look really different.
So basically what you're saying, and my understanding from what you're saying, is that if we work collaboratively in our community and have more compassion for each other, rather than moving away from the companion, the empathy that we feel for people as a whole, could be positive, it could be rewarding in that neighborhood, if that's what you're saying. Okay. So after long-term use of medication, could one become immune to meds? After, taking a medication for years and years and years, could they become immune?
I think so.
Okay.
I think they can become immune, but I think that's why other coping skills are put into place to help that person. And like Melissa and you were saying, like assessing that person to see what other things could help them, or also putting them in other resources to help them as well.
Okay. So as mental health professionals, what are some of the pros and cons of mental health?
That's a good question. I think in terms of mental health, I don't know that there's a lot of pros per se, but I do think that there has been a recent shift lately from kind of normalizing that is very widespread. A lot of people struggle with mental health in many different ways, and kind of reducing the stigma of it. So I think one of the positives that has come out of that is this emergence of kind of a community feeling, and really rallying around those who do have those struggles, to let them know that there's no shame in that there is a sense of community and support.
So do you think, working in this profession, do you think the DSM-4 and the transition to DSM-5, tell me what are those two manuals and how they are fixated in the community, DSM-4 and now DSM-5. What's the difference, and how is that better?
How is 5 better than 4?
Yes. What is 4 and 5?
Yeah.
And then how is 5 better?
So the DSM is the Diagnostic and Statistical Manual, I believe.
Yeah.
It's essentially kind of a dictionary or encyclopedia of every mental health diagnosis and the specific criteria that each person needs to meet in order to have a specific diagnosis. And so they do change over time. There's lots of research that goes into any changes that are made, but any mental health professional that does do any kind of diagnosing is very familiar with the DSM and kind of how to use that in our day-to-day work. I think as each edition is edited, there's large communities of mental health professionals that work in a committee style. They talk about each diagnosis and make updates that hopefully are more relevant over time. And so between 4 and 5, I know one of the largest changes was in regard to trauma-related diagnosis. And that was a really positive step in the right direction, I think, for realizing the more widespread impact of trauma. It took a lot of diagnoses out that maybe were not as person-centered, or maybe that the label or the description caused or could cause a lot of shame in someone who has that diagnosis.
You think the DSM-5, Andrea, is more effective for you as a practitioner? Do you think the DSM-5 is more or less a better tool than 4?
I don't really use the DSM-5
Okay. No problem.
as a social worker. However, but I do know that a lot of my colleagues do say that it does help them.
Because it's more general now. But the DSM-4 was a manual that put everybody in a box, right? You stick them in the box. This is where you stay for the duration of your life. Now, question. There are people who has been diagnosed for years and years and years through the DSM-4. How does that, can you tell me or kind of foresee how that could change with the DSM-5 now that they have new evidence? Because everything is evidence-based, right? So now that they have evidence of the generalization, rather than saying schizo-effective and all those clinical terms, they have kind of generalized some of it. So you deal with the DSM-5. What does that look like?
Well, I think you bring up a good point. So within the DSM-5, they've really done a lot of work to make things more, diagnoses more on a continuum. So for example, someone who is presenting with maybe some depression-related symptoms, there is probably 6 or 7 different diagnoses that are available to kind of give a better, more accurate understanding and explanation of where someone is on that continuum of symptoms. And so I think that can help maybe reduce some of the stigma around that, because in 4, a lot of times people were diagnosed with just the most severe form of that, and now there's many other options.
So now you can kind of fine tune and kind of really look into the situation more, because you have a wider variety of things to look at rather than pinpointing one particular thing like the DSM-4. If you have these types of symptoms, then we're going to put you in this box, you stay there, and that's your life history, right? So with that being said, why is mental health such a myth? And I think for us, the society, our community is more intimidated with mental health than the mental health clients, right? So kind of help me with that.
Well, I would say as an African American woman and growing up in African American neighborhoods and, seeing the little boy that, they call retarded or saying something's wrong with him, he's a little off or he's crazy or whatever, I feel as if that due to that stigma, a lot of our community does not believe in mental health. They feel as if it's always demons. You should get on your knees and just pray them out. But we can pray all day, but at the end of the day, we have to do the work to make sure that our mental is okay. So that's my take on the mental health.
I think, especially recently, because social media has such an impact often in the popular media and the news, there always seems to be a highlight on mental illness, and it's not always positive.
Right.
Especially recently, and there's been I think a light shown or a greater correlation made between violent crime and mental illness, and which is not always the case. There's a ton of research that shows that those with a severe mental illness are actually more likely to be the victim of violent crime than a perpetrator.
Right.
But that's not really how it's portrayed in the popular media.
And actually, my view on that is that the mental health individual is the least most threatening person in the situation, but because of the uneducated part of whom addressing it, the uneducated aspect of it from their point of view, their personal fears, because see, when people don't understand a certain thing, it becomes fearful. Then they're in the fight or flight. Yeah,
survive or swim or sink.
Right, but because misunderstanding. So I think if we take legislation and try to continue to educate people in the communities, especially our EMS services, if they could, and the police department and all those people who engage with people in that situation, once they began to identify what is really happening with that person, and then sometimes I believe their own triggers kind of come into play, because everybody more or less has had some form of trauma in their life, and if they can't understand what's happening inside of them, then it's going to look threatening, right? And so, in closing, I would say during this conversation, has your perception shifted more insightfully towards yourself and your profession, and how did it shift? As we sit here discussing mental health and working in that profession, how did you look at it now from 3 different perspectives?
Yeah, I think it just goes to show that it really is a person-centered field. So from the clients that we work with to hearing perspectives of mental health professionals who work in different settings with different communities, it's always good to come together and just kind of share things from our side of, whatever our work looks like, just to continue to deepen our knowledge and understanding.
Yeah, what's your take, Drew?
My take is that teamwork is very important in our field. Whether you're a social worker or a licensed marriage family therapist or substance abuse counselor, we all tie in together. We all hold hands and make the community a better place.
And I really appreciate you both coming and sharing this information. I want to thank you all for your contribution to the community and sharing your truth towards the compassion you give to those you serve, whose challenges of mental health is really misunderstood. And I want to thank you again for coming, and thank you all for tuning in to Talk to Me. Have a nice day.